When we face ethical dilemmas, we often ask, what's fair, or what's best for the common good? However, the care ethics lens asks, what do people need? Care ethics is rooted in relationships. It's not about specific rules or consequences, but it's about caring for people in particular contexts by listening to them and attending to their needs. However, this is not a one-size-fits-all approach. Under a care ethics framework, the appropriate response to a dilemma comes from looking at the individual or group's needs and the specific problem and the context that they're facing. Additionally, we don't care for people just because we're mandated to by a specific rule or imperative, but because we're all people who are interconnected and interdependent. Take a city trying to combat growing rates of houselessness. A rule-based approach might focus on enforcing property laws or laws against panhandling or camping. A utilitarian might focus most on cost efficiency. However, a care ethics-based approach is going to ask, what do people who are unhoused need? It will focus more on increasing shelters, food banks, mental health and addiction resources, and overall boosting long-term affordable housing. This way of thinking has its roots across all different traditions and different cultures. For example, under African communitarian views, morality is inextricably linked to the well-being of the community. Indigenous perspectives emphasize our relationship with nature as to a reason why we must care for the environment. Confucianism emphasizes personal relationships and emotions, and Buddhism's rejection of the self leads to an attitude where there's no reason not to care about preventing suffering for everyone everywhere. Unlike some of the other lenses, care ethics values the role that emotions can play in the decision-making process. Feelings like empathy or even anger can help us realize when there is a problem that needs to be fixed. When we reduce ethics to mere logic, we miss the complexity of human emotions and feelings and the need to respond with compassion. Care ethics helps us avoid that problem. From personal relationships to public policies, care ethics helps us remember that there is more to ethics than just doing what's right on paper.